Good morning to everyone. Myself, Rashi Kustrest. I am working as assistant professor in Suresh Gyanvihar University. So, my topic of foundation course is stress, psychiatric disorders related to stress, and understand your stress level. So, let's start. So, what is the stress and how it works? It can work as positive and negative in both ways. We can say that stress can be a motivator and can also be a degressor. Stress can be a motivator, it can be even essential to survival. The adrenaline rush or the 3F mechanism of the body, that is fight, flight, and fright mechanism, tells a person when and how to respond to a danger. That is a basic mechanism to cope with all the danger happens around a person. So this is very normal. However, when the body becomes triggered too easily, that means you are frightened by very little things which is happening around you, or there are too many stressors at one time. What are stressors? Stressors are those happens or those events or those things which provokes stress or which provokes 3F mechanism very easily and frequently in your body. It can damage a person's mental and physical health and becomes harmful to for your organ system to functionalize normally. Stress is a natural feeling of not being able to cope with the specific demands and events. However, stress can become a chronic condition. That means if it is acute, body is able to cope with it within minutes or within hours. But if it becomes chronic, that the person becomes triggered so frequently and so easily, then the patient or a person must take measures to cope with it. So, if stress become a chronic condition, if a person does not take steps to manage it, these demands came from work, relationships, financial pressures, and other situations. But anything that poses a real or perceived challenge or threat to a person's well being can cause stress. So, what will be the learning objectives from this lecture? Following are the learning objectives from these lecture. After the completion of the lecture, the student must be able to understand what is the stress, what are various types of stress, various psychiatric disorders related or associated with stress, and cope mechanism to fight with your stress level. That means how will you able to cope the level of stress inside your body with the very regular and normal activities. So again, what is the stress? When humans face a challenge or threat, they have partly physical responses, which is 3F mechanism. Means for a few seconds, a person may fight or fright. The body activates resources that help people either stay and confront the challenge or get to safety as fast as possible. In the meantime, body produces a larger quantity of the chemicals or neurotransmitters in the brain. These chemicals are the different hormones or maybe chemicals or neurotransmitters that are cortisol, epinephrine, and norepinephrine. The triggers the following reaction inside our body, that is increased blood pressure, adrenaline or epinephrine, which causes excessive uh, increase in the blood pressure, heightened muscle preparedness, excessive sweating, and alertness. Alertness also contributes dilating of people in the eye. All these factors all improves a person's ability to respond to a potentially hazardous or challenging situation. Norepinephrine and epinephrine also cause a faster heart rate. Sometimes that increased heart rate can also cause a heart attack or maybe stop your heart working. So Environmental factors that triggers these reactions are called stressors. Example include noises, aggressive behavior, a speeding car coming towards you, scary movement in movies if someone is seeing any horror movies or something, or even going on your first date. Feeling of stress tends to increase in tandem with number of stressors. So, what happened to our body when these stressors releases in excessive amount? Stress makes it difficult for the body to return to a normal level of functioning or stress hormone activity, which can contribute to number of problems in the following system or organ system in our body. Number one is cardiovascular system. Cardiovascular system contributes heart mainly. So when the body becomes so easily triggered by stresses, our heart trying to push more and more blood to make the situation normalize, to make the adrenaline rush slow. So this means our heart works very, very faster. To cope with it, our body releases more and more, our heart starts to pump more and more blood to cope with that. Same with the respiratory system, our breathing, our lungs trying to push and pull out more carbon dioxide and oxygen just to cope with the mechanism. Sleep, all these stresses can make your sleep very disrupted. Like normally you will awake, or a person which is suffering will be awake in the night. Sleep pattern will be disturbed. More regular intervals, a person wake up at very regular intervals, or the 12 hours or 8 hours general sleep will not be sufficient. Immunity, yes, when all these systems are interconnected with each other, like if the sleep will disrupt, immunity will also be disrupted. The immune system will work as slow as possible. The person will suffer very frequently with the normal things like cold and any allergy. Next, reproductive system, same happens with the reproductive system. All these systems will work slow. Common major life events that can trigger stress includes job issue or retirement. Generally, in the case of a student, a job issue is very common nowadays. Retirement implies that after retirement, after a period of working, when a person is free, different kind of thoughts coming in the mind. Lack of money and time. Lack of money is very basic, because in this environment money is very important. Money is needed for basic needs. So lack of money can also be a very big stressor. Bereavement, family problems, illness, moving home, relationships, marriage and divorce. These are common life problems. Other common reported problems may be driving in heavy traffic or fear of accident, fear of crime or problems with neighbors, excessive noise, overcrowding and pollution, uncertainty or waiting for an important outcome. So all these are the causes, can be a causes of stress or could be stressors. Now we'll see various psychiatric disorders related to stress. Number one is major depressive disorder, MDD. A substantial body of research and very few articles supports as assertion that stress, both acute as well as chronic, it causes causally related to the onset of MDD. That means chronic and acute stress could be a major reason behind major depressive disorder. This is not something very common, this is major. Recent research suggested that exposure to the chronic or everyday stress in financial, occupational, or personal life alone, or in combination with acute stress exposure, is more powerfully predictive of MDD than acute stress exposure alone. Means if a person is facing acute as well as chronic stress together, then the chances would be high that the patient may suffer from major depressive disorder. While short-term stress can be adaptive, that means acute stress which happens it could be adaptive for a certain period of time, but prolonged and chronic exposure to the stress can lead to a long-term dysregulation of many physiological as well as neurochemical processes inside body. So, this picture depicts some major symptoms of depressive disorder. Chronic emptiness. Chronic emptiness means a patient feels that something is empty inside us. Unyielding sadness, that means if anything will happen, the sadness will not go anywhere, that retain in a person all the time. If person is smiling outside, but it faces the person faces some kind of sadness inside body. Hopelessness, no hope for good, no hope for positive things. Restlessness, always feeling fatigue, always feeling that yes, something is going out, something is have to something I had to do. This kind of restlessness always running in mind. Fatigue, because of because lacking of proper sleeping pattern, the body will always be fatigued. No interest in hobbies, that because of restlessness which is always running in mind, the person could not be able to concentrate at one thing at one time. These are also the symptoms. Although depression may occur only once in your life, people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day, and every single minute of the life or of that patient. These symptoms may include feeling of sadness, tearfulness, emptiness, and hopelessness, angry outburst, irritability, or frustration. Not from big things, person become tends to irritated every time, even over small matters. Loss of interest or pleasure in most or all normal activities. Sleep disturbances, including insomnia or maybe sleeping too much. Tiredness and lack of energy, so even small tasks take extra effort. Reduced appetite and weight loss or increased cravings for food or weight gain, which generally increased cravings generally results in weight gain. And anxiety, agitations, or restlessness, slow thinking, speaking, or body movements because of the confusion running in the mind all over time, feeling of worthlessness or guilt, fixating on past failures or self blaming, trouble thinking, concentrating and making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicidal attempts, or suicide. Unexplained physical problems such as back pain, headaches, fatigues, restlessness all the time. So, all these were the symptoms which a person could or may suffer from MDD. Now, this picture shows pharmacological treatments for MDD. What are the different? These are the different drugs which may help a person to escape from MDD. Number one is SSRIs, that is selective serotonin reuptake inhibitors. Serotonin is a neurotransmitter in the brain, so these are the drugs which will help to reuptake. Next is selective norepinephrine reuptake inhibitors. Next are myoamine oxidases. Next, tricyclic reuptake inhibitors, tricyclic antidepressants, and other drugs are bupropion and mirtazapine. So all these drugs could help a person to fight with the MDD. Now, second psychiatric disorder is bipolar disorder. So, what is bipolar disorder? Generally, a person may happy at one time and may feel sad another time. The fluctuation of hormones and the fluctuation of feelings very easily is considered in bipolar disorder. So, stress is also thought to play a significant role in the development of bipolar disorder. Stress can trigger the main first maniac and hypomaniac episodes, predict episode reoccurrence, and lead to less favorable outcomes. Thus, there is significant interest in stress as a target for treatment in preventive strategies in bipolar disorder. Molecular imaging can be provide invaluable information on the molecular mechanism underlying the link between stress and bipolar disorder. So, these are the differences between bipolar and unipolar depression. What is bipolar depression? Euphoria means extremely happiness or a high mood that is extreme contrast to depressed mood. That signifies that a person feels very happy sometimes and very sad another time. Sleeping significantly less than usual and feeling energetic despite getting less sleep. Increased irritability or irritations, speaking faster than usual, restlessness, and difficulty focusing on working or multiple projects at one time. So, these are the symptoms of bipolar disorder. Now, we'll see the symptoms of unipolar depression. Constantly feeling sad, empty, or hopeless. Changes in appetite and sleeping pattern, feeling fatigue, a lack of energy, feeling guilt or worthlessness, frequent having thoughts of suicide and death, withdrawing from social activities or isolate yourself from social behavior or to interact with others. Bipolar disorder is a condition of extremes. A person with bipolar disorder may be unaware they are in maniac phase or not. After the episode is over, they may be shocked at their behavior, but at the same time, they may believe the other people are being negative or unhelpful. Means a person is totally unaware of his or her attitude. After the period is over, after the episode is over, the person may feel that no, I was right, I was nothing wrong, my thinking was all good and all right. The problem is with the others. So some people with bipolar disorder have more frequent and severe episode than others. The extreme nature of the conditions means staying in job may be difficult and relationship may become strained. There is also an increased risk of suicide. That signifies that if a person feels that he or she will be alone, or the other outsiders are not understanding him, so the person may also feel to attempt suicide, or suicidal attempts will come in his or her mind. These are the symptoms of bipolar disorder: feeling sad, hopeless, or irritable most of the times, lacking energy, loss of interest in everyday activities, antisocial kind of behavior, difficulty in concentrating and remembering things, feeling of emptiness or worthlessness, feeling of guilt and despair, feeling pessimistic about everything. Feeling pessimistic means there is no hope in anything. That means feeling pessimistic. And self doubt. Always doubt on his or her activity. Patient feel that maybe I'm wrong, maybe I'm doing something wrong all the time. That means self doubt. So these are building blocks for living with bipolar disorder. Medications. Mood stabilizers could be used, and antipsychotic drugs control depressive, maniac, and psychotic episodes. These drugs may or may not control the episodes in patient. Lifestyle changing. So, lifestyle plays a very important and significant role in any person's life. Sticking to a very particular lifestyle may help a person or a patient to get relief from different episodes. Sticking to a regular routine can help in sidestep unexpected triggers for mood swings. This make a big difference in the severity and frequency of your symptoms. Alternative therapies, electroconvulsive therapy, transcranial magnetic stimulation, and clinical trials may have pros and cons, but they may be worth considering when medication is not the option. This is very severe kind of condition. This when the condition becomes very severe, this ECT therapy will be helpful for the patient. Psychotherapies, in tandem with drugs, a variety of talk therapies help to cope with the symptoms and challenges of bipolars. Another treatment process which may affect a person suffering from bipolar disorder. An effective treatment plan usually includes a combination of following therapies. Psychotherapy. Psychotherapy means different counselors will be there to help the person to cope with the stressors and medications. Self-management strategies like education and identifying the early symptoms of an episode and possible triggers of episode. Helpful lifestyle habits such as regular exercise, yoga, and medications. These things will definitely help a person to cope with the bipolar disorder. But these are only things which can support a person. Bipolar disorder cannot be eradicated completely, but these things, all these medications will help a person to cope with the different episodes occur. Other therapies, as I said earlier, such as ECT, in cases that are poorly responsive to medication or where rapid control of symptom is necessary to prevent harm. ECT will be helpful for those who are suffering from chronic bipolar disorder. That means if person attempts regular suicide frequencies, or if person tends to harm himself or himself with sharp objects or something, then the ECT will be only the option. Next, psychiatric disorder is post traumatic stress disorder. What is post traumatic? Post traumatic, as the word said itself, post means after, traumatic means some trauma. This kind of stress held when person suffers person suffered from some kind of trauma in his or her life. Post-traumatic stress disorder is a psychiatric condition which, by definition, occurs in direct response to acute stress exposure or exposure to trauma. However, while approximately 80% of the individual will be exposed to a traumatic events in his or her life, that they are capable of conquering it. But only 8 to 15% of the general population will go on to develop PTSD. One reliable predictor of developing PTSD following trauma exposure is historical exposure to the chronic stress. That means if person suffered some kind of stress in his or her previous life, then it is very common that if a person will face something, then the PTSD will occur. As with MDD, that is major depressive disorder and bipolar disorder, molecular imaging has the potential to provide crucial insight into pathophysiology of PTSD, and specifically its relationship to chronic stress. Generally, PTSD is diagnosed according to the several clusters of symptoms occurring after exposure to extreme stressors. Its pathogenesis is multifacial, including the activation of hypothalamic pituitary adrenaline axis, immune responses, or even genetic discrepancy. These are the symptoms of PTSD. Avoid thinking of the trauma because that trauma will affect the person very badly, mentally. So the person will always avoid thinking of the trauma. Avoid talking of the trauma. The person will not find happy or helpful during sharing all those traumatic incidents with others. Easily frightened. If something related to that trauma happened around him or her, that trauma, that incident will easily frighten the patient. Negative mood, because of the continuous thoughts running around the mind of that trauma, the mood of the patient will always be negative. Negative thinking, always the person always tends to think negative around the things happening, always on guard. The mind will always be on alert mode of the patient, that what happened if the what the patient will always think that what happened if I would be face that same incident or same trauma again. So the person will always be in alert mode. Avoid places, avoiding activities, generally the person become antisocial and avoid all the activities to avoid that traumatic incident, or thinking of that, avoiding frightening incidents. Flashbacks, control concentration, cannot concentrate, the person will not be able to concentrate. Aggressive behavior, all these are the different symptoms. Lack of sleep, lack of concentration, and using of beverages like alcohol, etc. Treatment. So what would be the treatment? What could be the treatment? Post-traumatic stress disorder treatment can help you regain a sense of control over your life. The primary treatment is psychotherapy, but you can also include medications. Combining these treatment can help improve your symptoms by teaching you skill to address your symptoms, helping you to think better about yourself, others, and the world, learning ways to cope if any symptoms arise again, treating other problems often related to traumatic experience such as depression and anxiety or misuse of alcohol or drugs. So this picture depicts that what could be the treatments. There could be two type of treatments for PSTD. Number one is psychological intervention, and number second is pharmacological treatments. Psychological interventions may be CBT, CPT, CT, CR. All these are kind of therapies in which a counselor may help a patient. Coping skill therapies include stress inoculation therapy, exposure based therapy, etc. Next is EMDR, that is eye movement repressive re-aggression, hypnosis and hypnotherapy, brief electric psychotherapy. These are psychological interventions. Psychological interventions basically are those in which a person can help or could take help from the counselor. Psychological treatments include antidepressants, SSRI, that means serotonin, selective serotonin reuptake inhibitors, selective norepinephrine reuptake inhibitors, MAO inhibitors, sympatholytic drugs, alpha blockers, antipsychotics, anticonvulsants, and benzodiazepines. So now we'll run to understand your stress level topic. Then how can a person could understand that what stress level and on what stress level actually I'm suffering. You might be overly stressed without even knowing it. Maybe you have certain physical symptoms and blame it on the illness or other condition, but the truth is stress itself can cause problems in your organ systems, tissues, and just about every system in your body. Depending upon how you handle stress, you might have symptoms that affects everything from your hormone to your heart rate and more. Some of the physical signs that your stress level are too high include pain or tension in your head, chest, stomach, or muscles. Your muscles tends to tense up when you are stressed, and over time this can cause headaches, migraines, or musculoskeletal problems. These are the stages of stresses. Number one, fight, flight. We perceive some kind of threat. A person becomes trying due to adrenaline rush. This stage will come. Second is damage control. The person will try to control all the damage which happened around. Then the recovery. inside your body, inside your mind. Then adaptation, if a person will fail to adapt, then the burnout will happen. That is the stage 5. If a person is on stage 5, then he or she must wait to see the doctor to take help from the counselors, etc. Now, how can you manage your stress? Take breaks throughout the day, away from your workplace, move away from where you are working. Like if you're working in an office, this means you're not home. This means you're just going outside and taking some fresh air. If you already work outside, then perhaps going into the work cafeteria or breakaway is just as good. Number two is introduce laughter and fun into your daily life. Laughter is a medicine itself, so a person always try to laugh and always find good thing. Find ways to laugh at silly situations or introduce some playful approach to your daily routines. It means occasionally taking a bit of time to watch some comedy show or something. Physical activity. This is especially important for those of us who are spending a lot of time on the desk or in front of computers or in confined spaces. Taking a walk a couple of times a day is all that's needed, but you can increase this if you exercise daily. Exercise or yoga or meditation will help the body to cope up with the different stressors inside body. It is entirely up to what level of exercise you want. The point is to move around. And if you can do it outside, surrounded by greenery, it will all be better. Breathing exercises just to relax your mind and relax your body. It may seem trivial to take time out of your day to well breathe, but the benefits of breathing exercises has been proven time and time again. All you need to do is to sit and concentrate on your breath as it moves in out of your body. Try this square breathing exercises. Doing this a few times a day will help interrupt negative thoughts and patterns and calm your body. Increase your EQ skill set. EQ is crucial to professional as well as personal success, but it is often misunderstood. The easiest way to begin improving your EQ is take a bit of time to reflect on those things that went well throughout the day. Once you have identified the successes, congratulate yourself and celebrate these small successes. Then turn your mind to things that didn't go well and review what happened without any judgment, without any fear. So, all these things may help a person to cope up with the stress. So, thank you so much.